Hey there, welcome to Nurse Expertise. I'm Nima and today we have an exciting video for you. We'll be diving into the world of coronary angiography and its nursing care. So if you are ready to learn, make sure to hit that subscribe button and stay with us till the end. First things first, let's understand what coronary angiography is. It's a cardiac catheterization procedure used to diagnose structural and functional disorders in the coronary arteries. By inserting radio-packed catheters into a large artery, such as the femoral or radial artery, doctors can visualize the coronary arteries and evaluate blood supply. This information helps guide treatment decisions, including the needs for revascularization procedures like PCI or CAG. Now, let's talk about what happens before the procedure. Patients undergo various blood tests to evaluate metabolic and renal functions, as well as coagulation studies to anticipate the risk of bleeding. We also assess the patient's health history to determine any previous reactions to contrast agents and identify potential risk factors. Allergies to seafood or iodine compounds are particularly important to consider. During the procedure, patients receive IV catheters for fluids, sedatives, and contrast agents. Continuous monitoring is essential to watch for chest pain, dyspnea, changes in blood pressure, and EKG abnormalities, which could indicate myocardial ischemia or other complications. Our dedicated cath lab nurses are always prepared to provide advanced cardiac life support measures if needed. After the procedure, patients are required to rest in bed for a few hours before they can start moving around. The duration of bed rest depends on factors like the catheter site, anticoagulation status, and patient-specific factors. We closely monitor patients for any signs of complications and ensure they receive the necessary care during this recovery period. Now, let's talk about the potential side effects of coronary angiography. While it's generally a safe procedure, minor side effects are common, such as contusion, soreness, and a small bump near the incision site. These usually resolve within a few days or weeks and are nothing to worry about. However, there is a small risk of more serious complications, including kidney damage, heart attack, stroke, and allergic reactions. Rest assured, these serious complications are extremely rare. If you have recently undergone coronary angiography and experienced certain symptoms, it's important to seek medical help. These symptoms include uncontrollable bleeding at the incision site, severe pain not relieved by painkillers, redness, swelling, or heat in the skin, and any noticeable changes in the limb where the incision was made. Remember, these occurrences have a low probability of happening, but it's always better to be safe than sorry. Now, let's talk about the vital role nurses play in caring for patients undergoing coronary angiography. Nurses are responsible for preparing patients for the procedure, providing support during the procedure, and delivering post-procedure care. We ensure patients are well informed, comfortable, and receive the necessary medications and monitoring throughout the entire process. Before the procedure, there are a few key things to remember. First, ensure that the patient has been NPO for at least 8 hours prior to the coronary angiogram. This is important to ensure accurate results and minimize the risks of complications. Another important aspect of pre-procedure care is assessing the patient's kidney function. We check the levels of BUN and creatinine to determine if the patient has any impaired kidney function. This is crucial because impaired kidney function can affect the patient's ability to process and excrete the contrast substances, potentially leading to toxicity. Moving on to post-procedure care, one of the key steps is to check the insertion site for any signs of bleeding. We also assess the patient's extremity, particularly the distal puncture site, for pulse, capillary refill, temperature, and color. This helps us monitor the circulation and ensure there are no complications. Vital signs monitoring is another crucial aspect of post-procedure care. We take the patient's vital signs every 15 minutes for the first 4 times, and then every 30 minutes for 2 times, and then every hour for the next 4 times. This frequent monitoring allows us to detect any changes or complications promptly. Finally, after the procedure, it's important for the patient to lie for 4 to 6 hours. This helps prevent complications and allows the puncture site to heal properly. As nurses, we play a vital role in ensuring the patient's comfort, safety, and well-being throughout the entire process. By following these nursing care steps, we can provide the best possible care for our patients undergoing a coronary angiogram. And that's a wrap for today's video. I hope you found this information helpful and informative. If you did, don't forget to give this video a thumbs up and share it with your friends. And as always, make sure to subscribe to Nurse Expertise for more valuable content. Thank you for watching, and I will see you in the next video.